Breaking tonight, a CDC panel now recommending a single Pfizer booster shot for 12 to 15-year-olds 5 months after their second dose. It comes after the FDA approved the shot on Monday. Full CDC approval is imminent. Meanwhile, with new COVID cases up 98% in just 1 week, the Omicron surge has forced another major event, this time the Grammys, to postpone. The January 31st show now on indefinite hold, as hospitalizations are up 63%, deaths up 5% to 1,200 each day. Most of those patients never vaxxed.
Without a doubt, unequivocally, we are dealing with a highly transmissible variant that spreads rapidly.
The good news, more research shows vaccines and boosters offer very strong protection. But the CDC is also under fire for offering confusing, mixed messages on its own isolation guidance. Tracking back to December with Omicron raging, a national shortage of test kits led to hours-long waits at testing sites. Rising cases led to massive workforce shortages and airline cancellations. Businesses, including Delta Airlines on December 21st, called for shortening the recommended isolation period for the vaccinated who test positive. 6 days later, the CDC did just that, cutting the isolation time from 10 to 5 days. CDC Director Walensky said she was worried people would not stay home.
People would feel well enough to be at work. They would not necessarily tolerate being home, and that they may not comply with being home.
But Walensky did not recommend people first get a negative antigen test before leaving home. Today, she insisted the national shortage of test kits did not play a role in that decision.
This has nothing to do with the shortage of available tests, because you can see in our quarantine guidance that we actually do recommend a test for people to emerge from quarantine.
But a former COVID advisory board member says the test kit shortage was a factor.
That's really about availability of these rapid antigen tests, and they do remain in short supply across the country.
Many sympathetic health professionals worry the CDC is confusing the public and undermining its own reputation.
I'm very concerned about the CDC towing the line of whether or not we're basing our guidelines on supply, whether we're basing our guidelines on economics, or whether we're basing our guidelines on science, because it always should be rooted in science.
Tom, the American Medical Association just weighed in criticizing the CDC's recommendations.
The AMA says that the recommendations are confusing, and the lack of a testing component, it says, could cause this to spread even further. Hundreds of thousands of people returning to work while still infected. Lester.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.